I want you to imagine a scene that happens thousands of times every single day in doctors' offices across the country. A 78-year-old man, let's call him Robert, walks in for his routine checkup. He feels pretty good. He's active, he enjoys his walks, and he's keeping up with his grandkids. When the nurse takes his blood pressure, the machine read 148/86. Robert's doctor looks at the screen, looks at the official guidelines, and sees a problem. The standard says he needs to be under 130, so the doctor reaches for the prescription pad. A medication is added. Then, a few months later, another one. At the next visit, the numbers are perfect, 122/78. The doctor is pleased. Robert gets a metaphorical gold star on his chart. But here's the part the guidelines don't account for. That same night, Robert gets up to go to the bathroom. As he stands, his blood pressure, which looked so perfect while he was sitting in that office chair, suddenly bottoms out. It drops to 88/56 in seconds. His brain is suddenly starved of blood. The room spins. He reaches for the wall, misses, and the next thing he knows, he's in an ambulance with a fractured hip. After 2 decades as a cardiac surgeon, I've realized that the greatest mistake we make after the age of 60 isn't just having high blood pressure. It's the obsession with a perfect number that was never designed for an aging body. Today, I'm going to reveal the life-saving truth about why the standard blood pressure targets might be dangerous for you, and the 5 common mistakes that are quietly sending your pressure skyrocketing without you even realizing it. The myth of 120/80. For decades, we've been told that lower is always better, and if you're 45 or 50, that's largely true. But something fundamental changes in your cardiovascular system after you hit 60, and especially after 75. Your arteries aren't the same as they were 30 years ago. Think of a brand new garden hose. It's flexible and elastic. Now think of a hose that's been sitting out in the sun for 20 years. It's stiffer. It's less flexible. This is called arterial stiffness, or arteriosclerosis. Because your older arteries can't expand and absorb the pressure wave of each heartbeat, your body actually needs a slightly higher baseline pressure just to make sure blood reaches your brain and your kidneys. A massive study published in the Journal of the American Medical Association tracked 15,000 seniors for 5 years. What they found should have been front-page news. The seniors with that perfect 120/80 blood pressure actually had a 28% higher risk of serious falls and higher mortality rates than those with moderately higher numbers. The sweet spot for longevity and quality of life after age 75 isn't 120. It's actually between 130 and 145 systolic. When we push it lower, we aren't protecting the heart. We are starving the brain. Mistake number 1. The innocent. Pain reliever. Now, let's talk about the things you're doing at home that are fighting against your heart. Let's look at the medications sitting in almost every bathroom cabinet. NSAIDs. You know them as ibuprofen, naproxen, or Advil. I remember a patient named Michael. He was 72 and loved his rose garden. He had some knee arthritis, so he took an anti-inflammatory pill almost every day just to stay mobile. One afternoon, he felt completely drained. His ankles were swollen to twice their normal size. When he got to the ER, we found he was in acute heart failure. It wasn't a new heart disease. It was the innocent pain pill. NSAIDs work by blocking enzymes to reduce inflammation, but they also interfere with the substances that protect your kidneys and blood vessels. This creates 2 catastrophic effects. First, they force your body to retain salt and water. Imagine your heart is a pump and your blood vessels are pipes. If you suddenly dump way more fluid into those pipes, that pump has to work at maximum capacity just to keep up. Second, these pills can actually constrict your blood vessels and raise your blood pressure directly. If you're already taking blood pressure medication, NSAIDs can completely cancel out their effect. You're taking a pill to lower your pressure and another to raise it, and your heart is the one caught in the middle. Mistake number 2, the cold medicine trap. We've all been there. You wake up with a stuffy nose and a head cold, and you reach for an over-the-counter decongestant. The ones with pseudoephedrine or phenylephrine, they are marketed as magic for congestion. But for someone over 60, they can be a cardiovascular nightmare. These drugs are vasoconstrictors. Their job is to narrow the blood vessels in your nose to reduce swelling, but the drug doesn't know it's only supposed to work in your nose. It travels through your entire body, narrowing arteries everywhere. It's like trying to push water through a squeezed hose. The pressure inside the pipes explodes. This can trigger a dangerously high blood pressure spike and make your heart beat faster and irregularly. For a patient like Margaret, a 75-year-old teacher I treated, a simple cold remedy pushed her to the brink of a stroke because her heart couldn't handle the resistance. If you're over 60 and have high blood pressure, these should be completely off limits. Safer alternatives like saline sprays or humidifiers are your best friend. Mistake number 3. The stomach protector. Irony. This one will surprise you because it's marketed as a protector. I'm talking about PPEs, pills like omeprazole or Nexium that millions take for reflux. We prescribe these to protect your stomach, but they can create a backdoor danger for your heart. Your stomach needs acid to absorb nutrients. When you suppress that acid long term, your absorption of magnesium collapses. Magnesium is the conductor of your heart's rhythm. Without it, your heart becomes electrically unstable, leading to dangerous arrhythmias. Furthermore, some studies suggest these drugs reduce nitric oxide, the molecule that keeps your blood vessels flexible. When nitric oxide drops, your vessels harden, setting the stage for a heart attack. If you've been on a PPI for years, don't just stop. That can cause a rebound of acid. But ask your doctor if you really need it long term, or if you can switch to something gentler like Pepcid. Mistake number 4, the calcium supplement spike. For decades, the message has been take calcium for strong bones. But the truth is more complex. Calcium from food, like dairy or leafy greens, is absorbed slowly and used efficiently. However, when you take a high-dose calcium supplement, it creates an artificial spike in your blood levels. Your body can't use all that calcium at once for your bones. So, where does the excess go? It often deposits in your artery walls. This is called arterial calcification. It makes your arteries rigid and contributes to the very plaques that cause heart attacks. For many seniors, the risk of a heart attack from these supplements may outweigh the benefit to their bones. More is not always better. Always try to get your nutrients from your plate first. Mistake number 5. Ignoring the cascade effect. The final mistake is one that happens within the medical system itself. I call it the cascade effect. It starts with one test you might not have needed, like a stress test on a treadmill just because you reached a certain age. If you can walk 2 flights of stairs in your daily life without pain, you are already passing your own stress test every day. But if you get on that treadmill and have a false positive, which is very common in older adults, the wheels start turning. Suddenly, you're being scheduled for an invasive heart catheterization. You're put on 3 new medications. The anxiety alone can drive your blood pressure up, and before you know it, you've been labeled as a heart patient, and your quality of life has plummeted, all starting from a test you never needed in the first place. The 3-minute life-saving test you can do tonight. I don't want to just give you information, I want to give you a tool. There is a simple test that most doctors don't do routinely, but you can do it at home tonight with a $30 monitor. It's called the orthostatic test, and it can tell you if your blood pressure targets are actually putting you at risk for a fall. Here's the protocol. Lie down flat on your couch for 5 minutes. Just rest, check your blood pressure while lying down and write it down. Stand up and immediately check it again while standing. Compare the numbers. If your top number, systolic, drops by more than 20 points, or your bottom number drops by more than 10, you have orthostatic hypotension. This is a massive red flag. It means that even if your sitting blood pressure looks perfect, your brain is operating on insufficient pressure when you're upright. If you see this drop, it is time for an honest conversation with your doctor about lowering your medication dose or adjusting your target. The new sweet spot for your 70s and 80s. So what should your goal be? Again, these are guidelines, not rules, but here's what the most recent research suggests. Ages 65 to 74. If you are generally healthy, a systolic range of 130 to 140 is often ideal. Ages 75 to 84. The evidence supports a range of 135 to 145, over 85, or frail. A range of 140 to 150, may actually be the safest to prevent falls and maintain independence. We have to stop treating the number and start treating the person. Health isn't about having a perfect chart, it's about function. It's about being able to walk your dog, read your books, and enjoy your family without dizziness or fear. A final thought from my heart to yours. I know that some of what I've said today might contradict what you've heard for years. It's hard to shift a mindset that says lower is always better. But medicine is always evolving, and we are finally realizing that an 85-year-old heart and a 45-year-old heart need different things. Your heart has been beating for you for 6, 7, or 8 decades. It has worked in silence through every joy and every sorrow of your life. It deserves exquisite care. That care doesn't always come from a new prescription. Sometimes it comes from having the courage to say no to a test or let's wait on a medication. You are the CEO of your own health. You are an active participant, not just a passenger. Take your home blood pressure logs to your doctor. Ask the hard questions. Is this target right for my age? What happens if we find something on this test? If this information gave you a sense of clarity today, please share it. Send it to a friend who you know is struggling with dizziness or who is obsessed with their blood pressure monitor. You might just be the one to stop their cascade before it starts. Take care of yourselves. Listen to your body. It's the best monitor you'll ever own. I'm Dr. Matthew. I'll see you in the next one.